Okay, so you know that feeling, right? That nagging ache in your lower back? The one that just won't quit.
Yeah,
I mean, it's something a lot of us have probably dealt with at some point, or maybe are dealing with right now.
definitely.
And it can be so frustrating, right? Trying to sift through all the advice and treatments out there, trying to figure out what might actually work to get some relief.
For sure.
Well, today on this deep dive, we are tackling lower back pain head on.
We've got a super interesting piece of research, actually, that we're going to dig into.
Oh, yeah.
Yeah, it's a really massive analysis that looked at the effectiveness of all kinds of different treatments for non-specific lower back pain.
So that's the kind of back pain where, like, doctors can't pinpoint a specific cause, right?
Right, exactly. It's not like, oh, you got a herniated disc or something super clear cut.
Right, right. And you said this is a big analysis, so are we talking like one study or?
Oh, no, this is huge.
Okay.
It combined data from over 300 randomized placebo-controlled trials. So think of it like the gold standard of research, where you're comparing a real treatment to a fake one, a placebo, to see if the real treatment really makes a difference.
Right. That's how you know if something actually works, not just people thinking it works.
Exactly.
Okay, so 300 trials, that's a ton.
Oh, and get this, it covered 56 different treatments for back pain.
Wow. So they really looked at everything.
And they weren't all just done in one place either.
Oh.
These trials were conducted in 44 different countries around the world.
Okay, so all different kinds of people, all different parts of the globe.
Exactly. Which really shows you just how widespread this problem is.
Yeah, no kidding.
And the researchers found that in 80 to 90% of lower back pain cases, there's no single identifiable cause for the pain.
So that really is the mystery of lower back pain then, huh? In most cases, we don't really know exactly what's causing it.
Yeah, it's a real head-scratcher for both the people experiencing the pain and the healthcare providers trying to help them.
Right, because when you're faced with that much uncertainty, how do you even begin to choose a treatment?
Right. You're kind of shooting in the dark a little bit.
Yeah.
And current guidelines generally recommend starting with non-surgical, non-invasive approaches, which makes sense.
Yeah, less risk.
But even then, the sheer number of options out there can be overwhelming.
Yeah. Pills, exercises, all kinds of hands-on therapies.
It can make your head spin trying to sort through it all.
For sure. And that's what makes this analysis so interesting, right? We're going to find out what this huge study reveals about how well all these common treatments actually work.
Exactly. We're going to cut through the confusion and try to give you a clearer understanding of what might actually provide some relief based on real evidence.
I'm ready to get into it.
Wow.
Okay, so we've established that lower back pain is super common. It often doesn't have a clear cause, which makes it really tough to treat.
Right.
So what did this huge analysis actually find? Did any of the treatments really stand out as being effective?
Well, that's where things get interesting and maybe a little surprising.
Okay, I'm intrigued.
So despite the fact that there are all these different treatments out there and tons of research, the main takeaway from this analysis is that most common non-surgical treatments for lower back pain only provide a very small improvement in pain compared to a placebo.
So basically, they're barely better than a shingle bell.
Yeah, that's essentially what the data from hundreds of trials is suggesting.
That's kind of a bummer, isn't it?
Yeah, it's not exactly what you want to hear when you're in pain.
No, definitely not. But were there any treatments that showed more promise?
There were a few, but it's important to keep in mind that even the ones that were considered effective only offered small improvements.
Okay, small's better than nothing, I guess.
That's true. So for acute lower back pain, which is that sudden, short-lived kind of pain.
Right, like if you just lifted something wrong and threw your back out.
Exactly. The analysis found that only NSAIDs were more effective than a placebo.
Okay, so NSAIDs, those are like your ibuprofen, naproxen, those kinds of over-the-counter pain relievers, right?
Yeah, or prescription strength ones too.
Gotcha. And that makes sense because they target inflammation, which is often a big part of that initial acute pain.
Right. Now for chronic lower back pain, the kind that sticks around for months or even longer.
Right, the real naggy kind.
Exactly. A few different things showed some benefit. Exercise, spinal manipulation, and taping were all found to be effective compared to placebo.
Okay, interesting. So movement seems to help with that chronic pain.
It does seem that way.
And spinal manipulation, that's like chiropractor stuff, right?
Yeah, things like that. And then taping, that could be like kinesiology taping, things like that.
Okay. Yeah, I've seen people with that colorful tape on their backs.
Right. Now, in addition to those, antidepressants and drugs that target TRPV1 receptors were also effective for chronic pain.
Okay, TRPV1 receptors, those are like involved in how we perceive pain, right?
Exactly. They're part of our nervous system's pain pathways.
Gotcha. So it seems like there are a few potential avenues there for chronic pain, but again, the benefits were still pretty small.
Right. That's the key takeaway here.
Now, you mentioned that this analysis looked at a lot of different treatments. Which ones have been studying the most, even if the results weren't super impressive?
Yeah, so the ones that researchers have really focused on a lot include NSAIDs, which we already talked about,
Right, the over-the-counter pain relievers.
and then opioids.
Like strong prescription painkillers.
Right. Also, laser and light therapy, acupuncture, and a more gentle form of manual therapy called mobilization.
Okay, so those are the ones that we have the most data on, basically.
Exactly.
Even if that data isn't telling us they're super effective.
Right. Now, on the flip side, were there any treatments where the evidence suggested they really weren't effective?
That's a good question. Like, are there any things we can definitively rule out?
Based on what the researchers considered moderate quality evidence, a few treatments for acute lower back pain didn't show effectiveness compared to a placebo.
Okay, so what were those?
So, exercise, surprisingly enough, didn't seem to make a difference for acute pain.
Huh, that is surprising. I would have thought moving around would help.
Yeah, it's not always intuitive, is it?
No, not at all.
What else? Steroid injections also weren't effective for acute pain.
Interesting. Those are sometimes used for, like, quicker pain relief, right?
Yeah, but it seems like they might not be as helpful as we thought, at least for acute pain.
Okay, anything else?
Paracetamol, which is basically acetaminophen or Tylenol, that didn't show effectiveness for acute pain either.
Okay. What about chronic pain? Any treatments that were found to be ineffective for that?
For chronic pain, the evidence suggested that anesthetics like lidocaine and antibiotics weren't effective.
Okay, so those are pretty clear-cut then, at least based on the available evidence.
Right. Now, beyond those, there was a whole bunch of treatments where the evidence was just inconclusive.
Meaning we just don't really know if they work or not?
Basically, yeah. And this is a really important point because it highlights how much uncertainty there still is in this area.
Yeah, I imagine that's frustrating for both patients and doctors.
Absolutely.
So what kinds of treatments fell into that we're not sure category? I have a feeling it's a pretty long list.
It is, unfortunately. So for acute lower back pain, the evidence wasn't strong enough to say one way or another for 10 different non-drug treatments.
Okay, so things like physical therapy, massage, that kind of stuff.
Yeah, things like that. And then another 10 medications also had inconclusive evidence for acute pain.
Okay, so we're already at 20 treatments where we're just not sure.
Right, and it gets even bigger for chronic pain. There were 22 non-drug treatments with inconclusive evidence, including some really popular options like acupuncture, massage, osteopathy, and those TNS machines, the electrical stimulation devices.
Yeah, those are everywhere.
And then on the medication side, 16 different treatments for chronic pain had inconclusive evidence.
Like what kinds of medications?
Things like combinations of antidepressants and paracetamol, various herbal remedies, bone-strengthening drugs called bisphosphonates, and muscle relaxants.
Wow, so that's a huge number of treatments where we just don't have enough good data to say if they actually work better than a placebo?
Yeah, it really shows you how complex this whole thing is.
It really does. So with all this uncertainty, how confident can we even be in the results of this analysis? What are the researchers saying about that?
Well, they acknowledge that there are some limitations to the research. A lot of the individual studies they looked at didn't have huge numbers of participants.
Which makes it harder to see a real difference between treatments, right?
Exactly. And there were also inconsistencies across different studies looking at the same treatment. Some would find a benefit, others wouldn't.
Right. That definitely makes things murky.
And then another factor is that the type and quality of the placebos used in these studies varied quite a bit.
Oh, interesting. So like a sugar pill versus a sham treatment that's supposed to mimic a real therapy.
Exactly. And that inconsistency can make it harder to compare results across studies.
So basically, there are a lot of factors that can influence the findings, and we need to be cautious about drawing firm conclusions.
Right. And the researchers themselves are very upfront about that. They say that their analysis didn't find strong evidence that any of the treatments they looked at had a large effect on lower back pain.
So even the ones that were better than placebo, the effects were still small.
Exactly. And they point out that this is generally consistent with current medical guidelines and even their own previous research.
So this isn't really new information then, it's just confirming what we already suspected.
Pretty much, yeah. And they also said that, going into this, they had hoped to be able to provide more specific guidance on which treatments are worth investing in and which ones maybe we should reconsider.
But they couldn't because the evidence just wasn't strong enough.
Exactly.
Wow. So what are they saying we need to do then?
Well, they strongly emphasize the need for more large-scale, high-quality studies that compare treatments head-to-head against a placebo.
So basically, we need more and better research to really know what works.
That's the bottom line.
Okay, so bringing this back to everyone listening, what does all of this mean for how we should think about our own lower back pain and the different treatment options out there?
I think the key takeaway is that we need to be a little more skeptical, a little more discerning about the claims we hear about different treatments.
So don't just jump on the latest trend or believe everything you read online.
Exactly. There are a lot of treatments out there and a lot of people who will swear by one thing or another, but the overall scientific evidence suggests that most of these treatments don't offer a huge advantage over doing nothing.
So basically, we need to focus on what the best research actually tells us.
Exactly. Now, this doesn't mean that a particular treatment won't work for you as an individual.
Right. Everyone's different. Everyone's pain is different.
Exactly. And it's always important to talk to your doctor and figure out what's best for your specific situation.
Definitely. But it sounds like we need to go into those conversations with our doctors with a bit more knowledge and a healthy dose of skepticism.
I think that's a good approach. And it might also be worth focusing on those general healthy habits that we know are good for our bodies overall.
Things like staying active, maintaining a healthy weight, good posture.
Right. All those things can play a role in managing back pain, and they have other benefits too.
So it's not just about finding that one magic bullet treatment. It's about taking care of ourselves overall.
I think that's a great way to put it.
All right, so to sum it all up, it seems like the biggest takeaway from this deep dive is that while there are tons of treatments out there for lower back pain, the evidence suggests that most of them don't offer much more benefit than a placebo.
Right. And for a lot of treatments, we just don't have enough good data to say for sure if they work or not.
So the search for that definitive solution continues.
It does. But hopefully, the call for more rigorous research will eventually lead to clearer answers and more effective ways to help people manage their back pain.
Absolutely. It's an ongoing process. And with that in mind, here's something for everyone listening to ponder. Given what we've learned about the limitations of current treatments for back pain, how does this change your perspective on how we approach and understand pain in general?
Yeah, that's a great question.
Does it make you think differently about the information you encounter about pain management?
It definitely gives you something to think about.
It does. And as always, we'll continue to follow the research and bring you the latest insights. Thanks for joining us on this deep dive.
Thanks, everyone.